Hello, and welcome to The Mind of a Therapist, a podcast where I interview psychotherapists and helping professionals and what they're passionate about in order to provide you with messages of encouragement and hope. I'm your host, Andrew Earl. The Mind of a Therapist is sponsored by Psychological Counseling Services, healing hearts and transforming lives. Look into our intensive at pcsearl.com. In today's interview, I interviewed Dr. Peter Fraenkel. Dr. Fraenkel is Associate Professor of Psychology at the City College of New York and is in private practice in New York City. He received AFTA's 2012 Award for Innovative Contribution to Family Therapy for his work in the area of time and couples, integrative approaches to couple therapy, and resilience strengthening programs for homeless families. Dr. Fraenkel is the author of numerous books and publications. He is a former member of the board of directors and is an advisory editor for the journal Family Process, advisory editor for the journal of Marital and Family Therapy, a contributing editor for the Psychotherapy Networker, past Vice President of AFTA, and is currently co-chair of the Research Committee and a member of the Cultural and Economic Diversity Committee. So without further ado, here's my interview with Dr. Fraenkel. To start off, would you let our listeners know how you got into couple therapy? It's not something that everyone sees as desirable, sitting with two people that are often, in your case, at the end of the rope in a way. And what got you into couple therapy?
Yeah, it's a good question. Actually, I wrote an article years ago for the Psychotherapy Networker called Whatever Happened to Family Therapy, and the editor, Rich Simon, always asks people to write a bit about their personal history with whatever they're interested in. And so I wrote a bit about how I got into family therapy in general and couple therapy as part of that. I went to Duke for graduate school, and it was a mostly psychodynamic, individually based program. There was no course in family therapy. And yet, as I started working with kids, I really thought, gee, it would be really smart to meet with the parent and the child. But at that time, there wasn't a lot of that happening.
Sure.
We weren't getting trained in that. And also working with adults in their, talking about their intimate relationships. And, you get the sense that someone's got their narrative about what the issue is. And you're always wondering, gee, I wonder what the partner thinks. And what this person I'm working with maybe doesn't see about what she or he or they are doing or thinking that leads to problems. So the long and short of it is, when I went to Bellevue, NYU for my internship, there was a year-long practicum in family and couple therapy, and I felt like I found my home because systemic theory and thinking about people in their social context just made a lot more sense to me. And the other reason was I never could decide whether I wanted to be an adult therapist or a child therapist or a teen therapist. And this way you could do it all. And, the more I got into doing this work, I found it just very exciting, interesting, and effective to work with couples more often than with individuals when it came to relationship issues. If there are relationship issues, it kind of makes sense, if possible, to see the relationship and be able to observe the interaction and intervene with the interaction and the thoughts and feelings surrounding those. So that's how I got into it. And in terms of last chance couples who are on the brink of relationship dissolution, whether that's divorce if they're married or just dissolving because they're not married, it really happened just because in the mid-90s, I started seeing couples who would come into my office and say, you're our third or fourth, my record now is sixth, couple therapy, and we're on the brink of divorce, and you're our last chance. So the title Last Chance Couple really came from one of the first couples I saw of this sort, in the mid-90s. And my quick seat of the pants statement when the guy said, we're the couple from hell, I said, well, welcome to purgatory. And in that silly quip, I actually started really to create the frame that is so important in working with couples in this place, which is what I call, borrowing from anthropology, a liminal space, meaning betwixt and between. Okay, you're not committed yet to staying together necessarily, but you're also not sure that you're separating. So, how can we create a zone where we engage in what I've come to call experiments in possibility? Things that you can do together in a first session, right after a first session, that start to provide observable data that things can actually change.
Sure.
And, there are challenges in working with couples in the last chance moment because they're often high conflict or low passion, or one or both partners have done something that violates the safety, the trust, the values of the other, whether that's violence or falling into an addiction or, of course, an affair. So these couples do present us with, intense challenges. But the good news, in a way, is that they've been practicing their problematic patterns so long that they're very clear.
Sure.
You
Sure.
know, I often say with high conflict couples that they're like a lean, mean fighting machine. And, so it's very clear, especially if you know the research on what predicts from happy couples who ends up happy and together over years and who ends up distressed or divorced. And what distinguishes happy from unhappy couples is a lot of research, as I'm sure you know, from John Gottman, Howard Markman, many people. And if you know that research, you can really start to make changes with couples pretty quickly that
Hmm.
surprise them.
Yeah. And so when couples are in this liminal space, what? Well, let's say one of our listeners is in a relationship where they are deciding whether they're wanting to continue with the relationship. What's the most important thing for them to know? What do you like to share with these couples, and what do you like them to experiment with, as you were talking about?
Yeah, well, a few things. The first thing is, we always, no matter what kind of therapy we're doing, we always want to think about how do we build a trusting relationship, what we call the therapeutic alliance or the working relationship. Well, this is always a bit of a challenge with couples because they come in with different agendas, different narratives about their lives, and you have to be, as we say, multi-partial. You have to connect with each partner and validate each one's perspective. But when it comes to a last chance couple, where let's say one partner is thinking about leaving and the other is like, no, 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 please stay, uh, we have to connect with that ambivalent partner and we have to
Mm,
help them realize that we understand that they really are at a choice point and that that's okay.
yeah.
But so that they feel safe. Here's the kicker. We couple therapists usually give couples homework, things to do between sessions. But when as a last chance couple and one partner is seriously thinking about leaving, they may be reluctant to engage in these helpful activities because they're afraid if things get better, it will take the steam out of their decision to leave.
Uh,
So it's very important in a first session for the therapist to say, look, the only way I think I can help the two of you see the potential of this relationship is if I suggest some new communication skills, some ways of jacking up the passion again, whatever we end up working on. But I want to say to you, and I'm now looking at the one who's thinking about leaving, that even if things get better, from my point of view, you still may decide you want to leave because I don't want you to be afraid of trying some of these things because if you things get better, you feel like now you're stuck forever. And I
sure.
make the other partner make a commitment in that moment to um, letting the other partner go if despite their real efforts, they still that ambivalent partner wants to still leave. That's crucial.
Mm,
Otherwise, ain't going to go anywhere because yeah, there's going to be so-called resistance, but it's really fear of things getting better.
Sure, sure. Well, and
You
that,
know?
yeah, that's really honoring of that person's autonomy there and giving them that room to experiment and then kind of reassess once they're in this new place relationally.
Correct.
Yeah.
Here's a few other things. It's part of what I've written about a lot in this book I told you about. I'm writing. I have developed a kind of a theory of change that I share with couples because we often don't really articulate to our patients, to our clients, how change happens
Sure.
and what to expect as they try to change. So, principle one of what I call the creative relational movement approach is that insight and understanding do not automatically lead to interactional change. Now, this goes against a lot of psychotherapy theory and wisdom and practice, where it's like, as I was trained psychodynamically, if you help people develop insight, the solutions will just appear to them. I've rarely seen that happen
Sure.
with individuals, with couples, with families. It just doesn't happen. So insight is important, but actually, in a last chance situation, I privilege initially action oriented techniques because people have often had lots of individual therapy by the time they get to me. They understand their family of origin issues, they understand their internal conflicts, their anxiety, their depression, how it affects the relationship. And they're still stuck in destructive communication, in distrustful beliefs about one another. So the idea here is just talking about your miserable experience with one another repeatedly, week after week with a therapist, is only going to embed those stories more deeply.
Sure.
And that fits, by the way, with emerging research of Bessel van der Kolk and many others around trauma. The whole field of trauma treatment has changed over the last decade or so, where we realized by just listening to the person's traumatic story, it actually embeds it further in the brain. And what we really need to do, as Bessel would say, is get people moving and trying new things and starting to experience hope. One of the key things that people like Thomas Bradbury, a social psychologist at UCLA, and Carney, forgetting his first name right now, but others have looked at is is the degree to which distressed couple partners hold very strong negative attributions about each other's behavior. You coming home late because you don't want to be with me. You're not doing the dishes because you're trying to tell me that it's my job. You're spending a lot of money or whatever because you're trying to say I'm in control and you can't control me. So by the time couples come in this last chance moment, they have such hardened negative beliefs about what motivates their partner. The only way to disprove those is to have them try new things that disprove
Uh,
those negative attributions. That's why the action oriented approach is so important and why just insight and exploration of the issues never works. It's
mm-hmm.
not enough.
Yeah.
You know? So that's number one. The second really important thing is that anything you try new, whether it's a new golf swing, I'm a drummer also, a new rhythm on the drums,
Ah,
a new keyboard with a new computer, and certainly new communication patterns or ways of generating pleasure is going to feel artificial initially. Because what often happens is we will teach couples these communication skills, problem solving, give them, Gottman based suggestions about turning towards each other, statements of appreciation, all good stuff. But it has to come with a kind of like a warning label, which is, when you try these, it will, of course, feel artificial, forced. I'm suggesting it. It's not coming spontaneously. And just help people realize from experiences in their own lives of trying something new, whether it's a motor skill or anything else, that any kind of change is going to feel a little weird, awkward, artificial, and keep doing it and you're going to start laying down new, you know, neurobiological patterns and new automatic reactions. With last chance couples, it goes even further than that. Not only do the interactions, the new things feel artificial, they often can also feel irrational.
Hmm.
Here's why: because they hate each other, because they're so disappointed and lonely, and they've given up. And so to try something new goes against like years of history of disappointment. And so, in a weird way, not so weird, it almost doesn't make sense to try something positive.
Mm.
I don't know if you understand that, but
Yeah.
it's like I've had couples who improve with my help, and then even though they've improved and they're committed now to staying together, they'll say, "Yeah, but the only thing is we don't know if it makes sense to stay together." I'll say, "How come?" "Well, because we had this painful history. It feels almost irrational given our track record to go forward." And that might seem like, wow, that's crazy, but it's not crazy. It's like you've got certain ideas about who you are in this relationship, what the relationship is, and now it's doing better. And like, how do you make sense of that?
Huh.
So you have to warn people that they may improve, and trying the things that I suggest may feel not just artificial, but actually even irrational given how much suffering they've been through.
Sure. Is it almost a shift in identity then? Having
Very
some,
much,
yeah. Uh-huh.
very much. And that's, it's interesting you say that, because I think narrative therapy, which you may be familiar with,
Yeah.
Michael White, David Epstein, Steve Madigan, others, I think one of the great contributions of the narrative approach is its focus on identity
Yes.
and the way that problems infiltrate our identity. The problem story pushes away this now subordinated positive narrative of strength, and people don't even see the positive things that are going on. In fact, Gottman's research demonstrates that distressed couples miss things that the coders notice that were positive, but they don't see it. It's called negative sentiment override.
Uh-huh. Uh-huh.
They
Yeah.
literally don't even see when the other one is smiling at them or actually complimenting them. They don't get it because they have a very strong cognitive emotional bias towards seeing only the negative,
Yeah.
right? This
Yeah.
is straight out of cognitive psychology,
Sure.
right?
Sure.
Confirmation bias.
Sure.
So we unfortunately tend, as human beings, in our personal lives anyway, we tend to look for data that supports whatever we believe.
Sure. Sure.
Different than science. Good science has a hypothesis, and then we try to disprove our hypothesis. We want to see if we can collect data that disproves what we think is true. And if it doesn't, right, then what we think is true might be true.
Yeah. Yeah.
That's what something people don't understand about science. And because this is what we do personally, we suck up data like a Hoover vacuum cleaner to support that our partner is miserable to us and horrible to us, and we're a failure, or we're a failure as a couple, and so forth.
Yeah.
So absolutely, it's a lot about shifting identity through action, or what, in the early writing of Michael White talked about the landscape of experience, which is identity and thoughts and feelings, and the landscape of action.
Yep.
It actually comes from Jerome Bruner's work on in cognitive psychology. So whereas narrative therapists tend to do a lot of talking about the story and try to deconstruct it, while I think that's valuable, again, it feels too much to me like insight-oriented work. And I like to get people trying new things and then asking them, so how does this possibly change your identity?
Sure, sure. And yeah, I'm curious what some of these techniques are that you bring to the table with these couples. What are some of these things that you suggest, activities that they do to shift these
Yeah,
behaviors? Maybe you could give a bit of an overview of a number of them that you
sure,
use, and then I'd be interested to maybe dive more deeply into one that you'd like to share with our listeners.
sure. Before I do that, let me just
Yeah, yeah, yeah.
name the third principle, because it's probably the
Oh,
most
yes.
surprising in this creative relational movement approach, which is you don't have to be highly motivated to change.
Ah,
So it's interesting because you're a therapist, right?
therapist in
Yeah,
training. Uh-huh. Yeah,
therapist in
yeah.
training. So, one of the things that we kind of learn from our professors and sort of have a vague sense is that more highly motivated clients are more likely to improve. Well, actually, there's very little data to support that.
Hmm.
It's true in the addictions world. There's that Prochaska 5 steps of readiness to change and so forth. But actually, I was surprised because I had this idea, people who are very unmotivated, I see them changing when I suggest certain things that surprise them, which I'll talk about in a moment. And then suddenly the motivation increases because they have more hope. But you don't have to have like consistently high motivation every day to do these things. You have to kind of just do them and
Mm.
start establishing new patterns. And also by watching you and your partner communicate differently, treat each other better in many different ways, you start to believe in these activities, and motivation comes from that. Again, I'll use the metaphor of, or the analogy of drumming. I've been drumming since I'm 10 and I'm 63. So, if I want to keep up a regular practice schedule, it's not like I wake up and say, gosh, I can't wait to practice my roles. It doesn't go that way. Or if you're an athlete and you're going to go to the gym to work out, let's face it, we don't wake up every day and say, gosh, I can't wait to hit the gym. We get there, we start doing it, and then the motivation builds from the activity rather than hoping we wake up with this fire in our belly to do this thing and then we do it. It doesn't work that way. You have to have a general commitment to trying this stuff, but you don't have to be motivated day in and day out. And couples, this is often a very new idea to them because they haven't tried a lot because they feel so unmotivated. And I said, well, look, the only reason you're going to try some new things is if you see they start to work. And then you'll be more consistently motivated. But let's get going on this stuff. So, answering your question, one key thing I do with almost all couples is teach, research-based communication and problem-solving skills. I trained with Howard Markman and Scott Stanley at the University of Denver, and I actually back in the early '90s, and I brought their PrEP program, Prevention and Relationship Enhancement Program, to NYU Medical Center, and ran it for about a decade and a half, and I've taught it all over, sometimes with Howie and others written about it. So just with couples who've never been able to communicate well and who don't have a history they can look back on in their families of origin of parents communicating well or grandparents or anybody, this is like a revelation that they can actually talk with emotion, but in a more civil and fair and equitable way that eliminates power struggles and all that negative affect that Gottman has described so well. Criticism, contempt, and potential
Sure.
withdrawal, stonewalling, all that. So that's almost always an issue. And I should say, it's obviously something you do with a high conflict couple, right? But it's also important with the three other types of last chance couples that I've worked with because they're often kind of conflict avoidant. Particularly the toughest couples to work with are the ones who come in and they're not fighting a lot. They're just so disconnected, and the passion has gone out of the relationship. And so you might think, well, they don't really need communication skills. They're being rather civil with each other. But actually, they may have had a history of high conflict, and now they've just so given up, or they didn't have that history, and they just happen to be very conflict avoidant folks. And partly why they don't have passion is because they're afraid of the passion.
Hmm. Mm-hmm.
They're afraid of the negative side of the passion, getting frustrated with each other or angry. So you teach them some communication skills, and the life comes back into the relationship because they now have a safe way of talking. So that's a whole piece that can be extremely powerful. Let's talk about relationship strengthening enhancement stuff,
Mm.
pleasure building. One
Mm.
of the big mistakes that couple therapists make in working with last chance couples is that they only target or work with reducing risk factors like problematic communication, trying to get people, to handle their emotions, their negative emotions better, and so forth. And they can go on for weeks without really working with the couple to try out new pleasure building things. But I get couples trying new pleasure building things in the first or second session. However, the big mistake that couple therapists make is the suggesting the proverbial date night. Now, a date night, meaning going out to a restaurant with a couple that can barely talk to each other, not a good idea.
Yeah.
Because anytime they open their mouths, they start fighting. So instead, I developed years ago a little technique called the 60-second pleasure point activity. And what I ask the couples partners to do is brainstorm about fun, pleasurable, even sensual, not sexual necessarily, but sensual activities that last only a minute or less, 60 seconds or less of fun, pleasure, connection. And some of these you can do only when you're physically proximal or together, but some you can do using text or a phone call or, things like that. And so people will come up with stuff like, a hug if they're up for that, a kiss, or saying something nice to each other, a compliment, looking out the window, telling a joke, and, I've had some really fun, wild ones that couples come up with. My favorite one of all time was this couple in their 80s from a Jewish section of Brooklyn, older couple with a real accent, a Brooklyn accent. And this couple, they were in my prep workshop, but I add in the 60-second pleasure thing at the end of the workshop, and people were saying very tame sorts of stuff like, hugging each other, a kiss, holding hands, a little massage. And the old guy, who hadn't said a word in like 15 hours of workshop, he says, stroking your partner with a velvet mitt. His wife looks at him and says, Harry? Me? You? Velvet mitt? And then it went on from there. It was like looking at the window, saying a prayer, feeding each other chocolate. He raises his hand again. He said, this is for real. He says, listening to the bolero together. And at that time, one of the hot movies was 10 with Bo Derek, very hot. And the music was Ravel's Bolero, which is very erotic sounding. And it was just incredible.
That's a hoot. That's good.
And the funniest thing is, after that, I said, will I be able, without naming your names, to share this with couples going forward? They said, sure, no problem, Doc. Years later, my wife and I are walking in the East Village in New York. Who comes up? This couple.
No way.
I've been telling this story for a decade, and they're still alive. I said, and they say, Doc, how you doing? I said, great. I said, I have to tell you, I've always told the story, of your suggestions. Sure. And he smiled. And they smiled. I said, so how are you doing? And they said, he says, well, it was a very helpful workshop. And but I got to tell you, Doc, we haven't really used those communication skills that you taught us. But the wife looks with her glistening eyes. She says, but we're having a lot more fun.
Oh, that's good. I love it.
For real.
That speaks to what you were talking about earlier, about that action and behavioral focus. Making those shifts is key with couples.
Got to do it. So, another key activity, I'll just tell you one more. Yeah. These things are not complicated. A lot of couples don't have a daily, how was your day, dear conversation. And one of the things, too busy, with the kids, the work, take phone. And, one of the things that Gottman's research, again, has shown, and Markman's, is the importance of friendship and mutual soothing. So the how was your day, dear, 20-minute conversation, just listening to each other and especially with cisgendered heterosexual guys who are afraid of, their wives like talking endlessly about their day. What are they going to say? And they always want to try to fix it. I say, don't try to fix it. All you need to do, buddy, is empathic murmurings,
Uh-huh.
like like, oh, really? Oh, okay. Wow. Tell me more. That's all you got to do. And they're like, boy, I always thought I got to fix everything. You know what I'm talking
Sure, sure, sure. Oh, that's good. That's good.
about? Yeah.
And
There's a few ideas.
yeah, and so that 60 second pleasure point, do couples generally do that one time a day, once a week, a
Right.
couple
No,
times a day? How does that generally look?
what I suggest is 6 of these across the day.
Yeah.
That's what I suggest. So 2 in the morning before you depart, or these days in the pandemic, go to separate rooms to work. One, each partner initiating one, first period. Second, when you're apart, one each. And then when you're back together, one each. And I say, so who's good at math? How many minutes are we talking about? 6 minutes or less. And the idea is by creating these little points across the day, you create an arc of connection across the day in only 6 minutes or less.
Mm,
Now,
that's
here's the thing with last chance couples, they may feel like that's too much.
sure.
That's still too much. So then I said, well, can you do 2 across the day? Each of you initiating one.
Uh-huh.
Nobody can tell me that they can't muster up enough, energy to try like one thing. It doesn't have to be a hug or a kiss if they're not up for that. It can just be, saying something complimentary to their partner. What Gottman has talked about is mutual admiration. Because even if you're pissed off at your partner, you can still probably say, "I appreciate, what you do for our family," or "I think you're a terrific mom or dad," or, "You look nice today."
Yeah, absolutely.
Yeah. And, one of the other key things that this does, and that's so important, is that even when couples are still in pain, that they can still experience little bits of pleasure. From a narrative point of view, what we're doing is we're starting to build a narrative of connection, pleasure, along with the pain. We're not saying there's a lot of pain to work out.
Yeah.
We're just saying you don't have to do like, first phase of therapy, reduce all the pain, then get to the pleasure. Let's face it, when you met your partner at a bar or in your class or in the street or wherever one meets one's partner through friends, you don't immediately look at them and say, you seem like the kind of person I could solve difficult problems with for the rest of my life. Like, let's get married. Like, that's not why we do it.
Mm,
Why we're with someone because they're physically attractive, intellectually attractive, spiritually attractive, all these things. So if we don't pay attention to regenerating pleasure early on in this therapy, people will, they'll lose interest because, okay, you taught us how to communicate better, but there's still really not much of an incentive to stay together.
sure, sure.
The incentive is not only a reduction in pleasure and in pain and conflict, but an increase in pleasure that they thought, will never come back again.
Absolutely. And do
Yeah.
you, if couples are consulting you who aren't last chance couples, maybe they're there to work on their communication, strengthen their relationship, are you generally going to introduce these techniques as well and do those
Always. Yeah.
action? Uh-huh.
Right. So let me be clear that in terms of, are there special techniques for working with last chance couples? The answer is no. I mean, I use the accumulated research based wisdom and some of my own creativity, like the 60-second pleasure point. The key thing with the last chance couple is the frame that you build, that I described earlier, the therapeutic alliance and the tentativeness of the therapeutic contract. Like, you go week to week. You
Yeah,
don't, for
yeah,
instance, at the end of a session, normally we finish a session, we say, okay, let's figure out where we're going to meet next week. We take our phone out,
sure.
right? Not with a last chance couple initially. Now you have to say, so how was the session for you? What are your thoughts about returning? Do you want to think about it more? And I often will say, even in our first session, what would be one change you would want to see happen in our session that might convince you to try another one? Very different.
Mm.
We can't assume that they're wanting to come back to therapy. A lot of times, last chance couples, the one who's ambivalent says, I said I would come for one session, but I don't believe in therapy, or we've tried it before and I'm not very hopeful. Or they might even say, my lawyer told me to come to one session to show that I've tried, so to help with the custody issues or something. So you really have to respect that, as I said earlier, and you have to say, okay, so what would be one thing you'd want to hear? So maybe the ambivalent partner wants to hear an apology that they've never heard,
Hmm.
a real apology from a partner who had an affair, or started drinking too heavily, or was verbally abusive to them, or whatever. And we work, then I have a whole apology ritual too that I can tell you about. But basically,
Hmm.
you want to, that's the key with last chance couples. It's how you um, describe what you're going to be doing, the respect for their ambivalence, the partner's ambivalence, and then the techniques like communication skills that are useful for almost all couples, and all the 60-second pleasure point stuff, and
Hmm.
sensate focus, and in the sexual domain. All those tools are useful. So,
Oh, great. Yeah. Well, Dr. Fraenkel, we're coming to the end of the interview
sure.
here, and I appreciate this information so much. I know that as a therapist in training, a lot of my group supervision, what some of the harder topics and cases we've talked about have been these last chance couples where
Well,
one person's half out the door, and so
yeah,
I think this interview is going to be incredibly valuable for psychotherapists who are listening, but then also for our listeners who are in relationships themselves. And like you said, these techniques that you've mentioned with these behavioral shifts can help not only people who are last chance couples, but also anyone in a relationship.
absolutely.
And so I really appreciate your time. And
Welcome.
the question I like to end with is what's a message of hope that you'd like to leave our listeners with?
Things can change.
Mm.
And on the other side of that, if nothing changes, nothing changes.
Mm.
This is a saying from the AA program. They have lots of great little sayings like that, right? In fact, another one I like, because I work with people struggling with addictions and alcohol and stuff, is you can't think your way into new action, but you can act your way into new thinking.
Mm.
And I would add feeling. You can't think or feel your way into new action, but you can try new things and you might get surprised.
Mm.
You might suddenly be looking at yourself and your partner in the relationship in a very different way that you couldn't even imagine, because your pre existing thoughts and assumptions basically tell you that it's hopeless.
Mm. Mm.
So when we step out of the forest, if you will, the dark forest of our negative assumptions about ourselves, the world, our partner, and try something seemingly irrational,
Mm.
we get surprised in a good way.
Oh, that's good. To irrationality then. That's nice.
I honestly think that one of the key things to any kind of therapy is helping a client take an irrational step,
Mm.
irrational from their negative point of view.
Yes. Mm.
Yeah, it's different than, and I was trained in cognitive therapy for depression and stuff. With all due respect to that approach, once again, I've never found just kind of like trying to cognitively restructure people's thinking does it, because depressed people will always win. They'll put you on the mat and grind you down, and so you have to say, look, I'm not even going to try to argue with you about how your boss sucks and how you're incompetent and stuff. I only want to suggest little things that might prove to you with your own eyes and ears that that's not true. But me trying to argue you out of your negative feelings, Uncle.
Yeah, absolutely. Well, thanks again, Dr. Frankel. And if people want to get in touch with you, where would be a good place to direct them?
They could go to my website and contact me through there, PeterFraenkelPh.com.
Perfect.
And it's spelled, as you know, but last name is Fraenkel. So it's PeterFraenkelPh.com. And where are you in training?
Regis University.
Oh, okay.
Yeah.
Cool.
So
Yeah,
I've only got, this is actually my last week of internship, and I'm in my final stage here. So
beautiful, man.
It's
Good for you.
Yeah, thanks. Well,
All right.
thanks so much for being on the podcast again. I'll put your information in the show notes so listeners know a lot of great information on your website. There's a number of articles. Pleasure Point I remember seeing on there.
Yeah,
So
it's in there.
absolutely, listeners, go check that website out.
In fact, the article, the 2019 article in Family Process called Love in Action, an integrative approach to last chance couple therapy, lays out a lot of what I talked about today.
Oh, perfect.
Yeah.
Great.
And
Well,
my book will come out next year with Norton on the same topic, last chance couple therapy.
Perfect.
Yeah.
Please press the subscribe button, as well as rating and reviewing our podcast. This helps others connect with what you've been hearing. If you have any questions, please contact us at themindofatherapist@gmail.com. These questions will be kept anonymous. I want to thank Eric Price for the wonderful music you hear in this podcast. Additionally, this podcast was created to provide accurate and authoritative information on the subject matter. Although we are interviewing licensed therapists, they are not your therapists. This podcast is not intended to serve as direct medical advice and should not be used as a substitute for direct professional help. It is given with the understanding that neither the host, publisher, guests, or PCS are rendering legal, clinical, or other professional information. If you need a professional, we encourage you to find one. Visit Psychology Today to connect with a licensed clinician near you.